Hi, so today we're going to talk about diabetics and spa pedicures. What are the risks of going to your local nail salon? So a common complaint I hear as a chiropodist is that a patient will come in with an infection, and that infection can be traced back to their last visit at the local nail salon. So these things can happen for a few different reasons. Spas or nail salons that do not follow proper precautions can contribute to serious communicable infections like hepatitis B, C, HIV, and this infection can be spread whenever the infected skin, blood, bodily fluid come into contact with another person. Risks are increased at the spa given the amount of clients they see per day and the time taken to disinfect in between clients. So when a foot bath is used, for example, and it's not properly disinfected, which includes the jets, you may be exposed to contaminated water. Exposure to contaminated water can lead to infection, especially for someone who's just freshly shaven their legs. Bacteria can get in through the hair follicles, and that can cause a bacterial infection and maybe some pus-filled blisters on the legs. So a big source of contamination is through the instruments themselves. Not all spas follow proper sterilization techniques and disinfection of their instruments. So technicians that are using sharp and possibly contaminated tools, if they're not following these proper protocols, these sharp tools that have the potential to injure a patient can then cause cross-contamination and spread the infection to the next client. Technicians are not required to have any formal training or qualifications for their position. They do not belong to a regulated health profession or a regulatory body, so that leads to a lack of oversight and regulations. And if there is no oversight and regulations, there's nobody holding them accountable.